By the time you're finished watching this documentary, at least one person in the US will have died from an opioid overdose. This adds up to about 100,000 deaths per year. A community of Silver Spring, Maryland is no exception to this trend.
In 2012, for instance, there were 648 opioid deaths in Maryland. And then so from 2022 to October of 2023, which is kind of the latest numbers that we have, there were 2,600. So that's a 400% increase of opioid deaths in Maryland in about a decade.
There have been 3 waves to the epidemic, beginning in the 1990s when pharmaceutical companies misled doctors and patients about the addictiveness of new opioid pills, resulting in a rise of prescriptions. In 2010, heroin attracted users that were already addicted to prescription drugs. We are now experiencing the 3rd wave, with a surge of illegal synthetic opioids like fentanyl since 2014. After more than 3 decades of this epidemic, why does this problem still persist, and what more can be done to save our classmates and our community? In the last 30 years, there have been a lot of advancements in treating opioid use disorder, including methadone and buprenorphine, which work to reduce withdrawal symptoms. In 2015, the FDA approved Narcan nasal spray, a life-saving treatment that can reverse a fatal overdose, and is available in many middle schools and high schools, highlighting the opioid epidemic's impact on the youth. While treatments have lowered opioid death tolls, there is a significant barrier in accessing them.
There's been approximately 10 to 15% decrease in overdose deaths across the country. In certain communities, like African American individuals are still dying at the same rate, while overdose deaths for Caucasians are going down.
While OUD can affect anyone of any background, mental health challenges and poverty often occur alongside and drive substance abuse.
We have people that are in the mental health, there's substance use, but it all comes together at the end of the day. Whether you're struggling with substance use, you didn't get to substance use by yourself. You got there because of something else that wasn't dealt with.
Minorities are more likely to become addicted to opioids and to seek illegal options when they cannot access legal painkillers. Once addicted, these communities are the ones that face the most barriers in accessing treatment.
Methadone is something that requires somebody to go regularly, daily, to a center to get that treatment. Buprenorphine is something I could just pop out of my medicine cabinet and take it. It's incredibly convenient, and when it's convenient, it's going to be more effective. And so this double standard that exists, because in areas that usually are the wealthier sort of communities, access to buprenorphine is much higher than it is in the inner city.
Even if these treatments were made easily available, structural, individual, and societal stigma surrounding opioid use stops over 47% of users from seeking treatment.
We could do better to do actual public education that's about reducing the risk associated with drug use.
It is unclear how the upcoming administration plans to combat the opioid epidemic and support recovering addicts. While Vice President-elect J.D. Vance has been outspoken about the impact of opioids on his family and community in Ohio, the Trump campaign website focuses almost exclusively on reducing the flow of opioids.
In 2021, President Biden swung open the doors to our southern border, and the impact of that continues to be negative. That decision invited drug traffickers into our country.
I will insist on the full cooperation of neighboring governments to dismantle the trafficking and smuggling networks in our region, and I will ask Congress to ensure that drug dealers, kingpins, and human traffickers receive the death penalty.
And while stopping the supply of illegal drugs is one crucial step to addressing the opioid crisis, it is only part of the solution.
To focus all our efforts there and not deal with the consequence of that exposure, which is the substance use disorder, and not give that ample resources and support to help those patients, is not going to work, right? Because when you have a substance use disorder, you're going to find what you need somewhere.
In order to permanently address this epidemic, the upcoming administration must work with Congress to fund evidence-based drug treatment strategies in communities across the country. There is also a crucial need for mental health support to address the underlying cause and contributing factors to the drug abuse. Despite some promise at state level, nothing has been done at the national level to decrease deaths from opioid use. In a 2024 study conducted by public health professionals in Massachusetts, researchers concluded that a multifaceted approach was the best solution for states highly affected by the opioid epidemic. After using this approach, including prevention, harm reduction, and treatment, opioid overdose rates fell by up to 41%. In our state of Maryland, elected officials have begun to follow the example of other states that have effectively lowered addiction and overdose rates.
What we've done and what I've been involved in specifically in Maryland are two different points of legislation to address this issue. One was a Good Samaritan law, which incentivizes people who are around an overdose to call the paramedics and to call the police to ensure that that person is getting aid without the fear that they'll go to jail. So in every public building in Maryland, I passed a bill to make sure that naloxone is co-located with every AED, and that's going to be online by the end of next year.
Our message to the new president is clear. We know what it takes to create meaningful change and combat the opioid epidemic. We just need to decide we care enough to invest in our most vulnerable community members. By removing barriers and educating our youth, by reducing stigma and increasing access, we can end the opioid epidemic and bring a better future for all Americans.